Hi, my name is Ross Pelton, and I want to welcome you to my course on natural therapies for depression and anxiety. This course is over 4 hours long, and it contains an enormous amount of information. I don't expect people to view this program in one sitting. I've organized the course so that each section contains only 1 or 2 topics. Most sections run between 5 to 8 minutes long, but some are shorter, and a couple of them run 14 to 17 minutes long. You'll notice that I've included the references on the slides when I'm discussing the results of a scientific study. I've done this because I want people to realize that the information I'm presenting has been documented and reported in peer-reviewed scientific journals. I think this adds an important level of credibility to the information. Also, many health professionals have told me they want to know when and where specific information was published. Now I'd like to spend a few moments introducing myself and tell you a little bit about my background. I've been a registered pharmacist for many years. My pharmacy education gave me a good background in science and especially the knowledge of prescription drugs. In 1980, I had a life-changing event when I happened to get introduced to yoga. Up until that time, I'd been pretty much an average American guy who frequently ate at fast food restaurants and really didn't know much about health. When I started going to yoga classes regularly, I began to become friends with people who were interested in health. They exercised regularly, they ate healthy food, and some of them were passionate about wanting to continuously learn more about health. This turned out to be a very important event for me because some of my new friends from yoga introduced me to health books, health magazines, and health newsletters. I quickly began to read an enormous amount of new health-related information. With my background in science, I quickly realized that all this new health information just made a whole lot of sense to me. And I was almost immediately interested in and fascinated by all this new health information. So yoga changed my life. Through yoga, I got introduced to health, and my interest and fascination for all things related to health continues to this day. I eventually went on to get my PhD in psychology with an emphasis in holistic health. And in 1994, I passed an exam to become a certified clinical nutritionist. As my passion for health continued, I began to feel an urge to share health information with others. I wrote and self-published my first book in 1986, which was titled Mind Food and Smart Pills, which was about intelligence-enhancing drugs, herbs, and nutrients, and the prevention of brain aging. Several years later, Doubleday expressed an interest in this book. At that time, I rewrote and expanded the book with my wife Taffy as co-author, and the Doubleday edition was published in 1989. In 1986, my life took a really unexpected turn. I was offered a job that took my wife and I to Mexico. I became the hospital administrator of one of the world's largest hospitals that specialized in alternative non-toxic cancer therapies. I remained in this job for 6 years, from 1986 to 1992, and because of that job experience, I gained a great deal of knowledge about cancer and alternative cancer therapies. My next 2 books were published by Simon & Schuster, and they were a direct result of my extensive experience in alternative cancer therapies. Alternatives in Cancer Therapy was published in 1994, and How to Prevent Breast Cancer was published in 1995. As I continued to learn more about diet, nutrition, and various other health topics, I began to give lectures and seminars on a wide variety of health topics. Although I was still working as a pharmacist as my primary source of income, I began to get serious about wanting to develop a second career as an author and a health educator. You see on this slide that I say I'm bilingual. The 2 languages that I speak are English and science. I began to realize that one of my real talents was to digest and understand scientific information and then be able to express or teach the information to lay people in a way that they could understand it. I'm now the author of 10 books. There's one of my other books that I want to say a few more words about in this introduction because it pertains directly to much of the information in this course. My book, titled The Drug-Induced Nutrient Depletion Handbook, has become somewhat of a classic reference book for health professionals. My research for that book gave me a much deeper understanding of the health problems that are created by the nutrient depletions that are caused by the prescription drugs that many people are taking. Much of this information will be explained during this course that you are taking. I really believe that most health problems can and should be treated with natural therapies, and in most cases, natural therapies should be used first, before traditional medical approaches with drugs are approached and utilized. I also want to say that I believe that most drugs are toxic. They have to be detoxified in your liver. They're not normal to the human body. Nobody has a Prozac deficiency. Here's a photo of my wife, Taffy, with me, and I want to mention that my wife, Taffy, and I teach a college course at Southern Oregon University to students in the master's degree program in counseling psychology. The official title of our course is Psychopharmacology 584, but we refer to our course as Integrated Psychopharmacology. On this slide, I have a picture of the textbook that is the required reading for our students who take our course, Psychopharmacology for Helping Professionals, an Integrated Exploration. We feel that this textbook presents a fairly balanced overview of both medical and alternative approaches to psychotherapy. I want to stress what I feel is a really important point. Medicine and psychiatry basically have just one approach to the treatment of mental health problems: prescribing pharmaceutical drugs. Years ago, psychiatrists used to actually do talk therapy with their patients. Now, most of them primarily just write prescriptions for drugs. Taffy and I teach integrated psychopharmacology. There are two main components to our approach. Taffy teaches the psychology component, identifying trauma issues, identifying childhood, family, and relationship issues, and exploring many different forms of psychotherapy. I teach the pharmacology section, diet, nutrition, and lifestyle factors, drugs and their side effects, and then I cover all of the natural therapies to treat depression and anxiety. I want to emphasize that I only teach one half of what a comprehensive approach to treatment needs to be. In addition to the material I am teaching in this course, Natural Therapies for Depression and Anxiety, it is also vitally important that individuals with depression and anxiety also work with a competent psychotherapist and engage in regular counseling sessions to gain a better understanding of their own personal psychological issues. Some of my primary goals for this course: I'll be presenting a wide range of general health information. I'll be going over the history of drug development. I'll spend a good deal of time covering what I consider to be some of the most important controversies in psychiatry, and I'll discuss how the prescription antidepressant and anti-anxiety drugs work and why they're dangerous, and a lot of information about their side effects. And then the body of work in this course will be a discussion of the natural therapies for depression and anxiety and an explanation of how and why they work. So that's the basic goals that I have for this course. A few more comments about goals. I'll be addressing some important social, ethical, and moral issues relating to psychiatry regarding how drugs are developed, marketed, and how they're used to treat people. I also want to provide help, hope, and motivation for people who are taking antidepressant and anti-anxiety drugs. I want you to know that there are effective natural therapies available. Unfortunately, most psychiatrists and other mental health professionals are not knowledgeable about alternative therapies, or if they are, they frequently have a negative opinion of them because the alternative therapies are not approved by the FDA and the American Medical Association and other mainstream health organizations. The information in this course is basically for two groups of people. First, the information on natural therapies is excellent for people who have mild or moderate depression or anxiety, or who may develop mild or moderate depression or anxiety at some point in the future. Secondly, at some point, many people who are already taking prescription medications for depression and or anxiety want to try to discontinue them. The natural therapies are often very helpful for those who want to try to gradually reduce and/or eliminate their prescription drugs. I want to emphasize, though, that I am not suggesting that anyone change or stop taking their existing medications. I'm a health educator who has organized information on natural therapies, and hopefully I'm able to explain how and why these natural therapies work in a way that is understandable to you. If you're taking prescription drugs for depression or anxiety, you should consult with your physician before attempting to make any changes. I especially emphasize that this is important to communicate with your physician about any natural therapies you're intending to try. That's the end of my introduction to myself in this course. Now, let's get started on natural therapies for depression and anxiety.